So we've covered a number of topics on both of these conditions, which are really critical. What we'd like to do right now is answer some of the questions that you've submitted prior to the webinar tonight. I also want to point out that using or this particular educational series that we're doing right now is really something to help people get their life back. We've dedicated our research and our program addressing a lot of the issues that people have with medical cannabis. And I should mention that if you are in fact looking at a patient looking for support, please feel free to check out our webinars, marijuanaaware.com, and also the YouTube channel, which is YouTube/marijuanaaware. Both of those are great resources for you. I do want to point out this is the last webinar of our particular series of our second quarter series. We will be doing some broadcasts this summer, and we'll be posting in about 2 or 3 weeks the schedule for next quarter. I also want to point out I work with Manny Alfinas. He's with the Blunt Joint, and he actually can help with answer a lot of questions for you out there. If you're looking for a medical marijuana card, I recommend the Medical Marijuana Treatment Clinics of Florida, primarily because what they do is they not only have 22 locations here in Florida, but they also will help you. They provide education like you see right here. And they also have a hotline, a call line that you can call if you have any particular issues about using cannabis, dosing, or anything else. And then naturally, I want to mention the question becomes, where do I get my products? And that's where AIR comes into play. I think AIR has done a great job of putting out medical cannabis products. And one of the reasons I really like to use them is I like dispensaries that make it obvious as to what the products are. They have certificates of analysis, and that's available on their websites and with every one of their products. Michael, that's a huge benefit to patients who come in and buy product from you.
Yes, Mark. It is, I've heard not only heard from other patients, but personal experience. Not all dispensaries offer that information, or shall I say, it's not as easily accessible. But we list it on our websites. When you're shopping online or browsing, you can open this certificate of analysis. You can see your terpenes, see the percentages, specific terpenes or your terp percentage levels, which is very helpful in picking your product and really gives patients the insight into getting the best benefit of the product they're wanting.
Sure. And that's a real benefit that's there. Let's jump into the questions that have been asked prior to this particular webinar, and let's get some of those answered. One of the questions that comes up is how many new cases of CUD are reported each year? And that's a good question because what we're looking at is what's the latest statistics on this? And really it comes from 2021. Unfortunately, there hasn't been a lot of the statistics published for 2024. But we know that 5.8% of the people 12 years and older can, in fact, have cannabis use disorder. And that translates in the United States to 16.3 million cases that have been reported annually. This does not take into consideration the differences between medical cannabis use and recreational cannabis use. So that's kind of something that is really important. Like I mentioned, it is serious. It is something that people use. And again, going back to understanding this, many people are using cannabis beyond that therapeutic dosing level, going into that downward part of the dosing phase and really getting themselves overusing the product. If you back off to your therapeutic dosing level, you won't typically have this particular issue. And that's where the tolerance breaks and things like that comes into play. Let's jump into the second question, which is how long do you need to stop using THC to lower your tolerance? And that is really an excellent question. Michael, tell me about tolerance breaks and how long do you really need to take to be able to hopefully reset your body?
Well, tolerance breaks are just taking a period, a time frame where you don't use cannabis. You avoid using it as, ideally as least as possible. Now, some users just have to cut back. They may have chronic pain that is too severe. They can't just, completely quit without having some form of relief. But typically, it's a
Michael, I should point out
typical.
you hit an important point. They recommend 1 to 5 days. In my particular case, I have herniated discs in my neck. I can go about a day, maybe a day and a half. And then my neck taps my shoulder and says, if you don't do something pretty quickly, I'll let you know I'm here. So it depends on the patient and the situation. Like I say, I try to stretch it out as long as I can because it resets my body. I would ideally like to go 4 days, 5 days, but in my particular case, as was mentioned in the video, the chronic pain just isn't going to let me do that. And I really don't want to live in pain.
I'm completely with you, Mark. I medicate. I don't have as high as arthritis symptoms. So, for me, for anxiety and stuff, a tea break is really important, being that that's the reason I medicate.
Mhm.
Just because, I get to a point where the products aren't working the way they used, that they were at first.
Mhm.
And taking that little, that 1 to 5 days, more so for me being, 3 to 5 days, I really can see the difference. And when I go back to using my product and how much of the benefits I'm getting out of it, as opposed to never taking a break, being a user for years. And it really helps me get the best out of my product and helps alleviate some of the negative effects of overuse of cannabis.
Great.
Cannabis.
Thank you, Michael. Let's jump into the next question. Can I reduce my cannabis use without withdrawal symptoms? And I would say the answer is yes. One of the things about cannabis that differs from a lot of other substance abuses is it doesn't have a property that causes your body to require it. In other words, if you look at opioids, you look at heroin, you look at alcohol, even tobacco, those products innately get you into a situation where that almost forces you to be able to go back to using that particular product. Cannabis isn't that way. You can stop. And you're not going to have any withdrawal symptoms per se, other than that condition that you're trying to address really comes back or it stays there. In my case, the herniated discs in my neck. One of the things you can do is you can actually reduce the amount of THC while increasing the amount of CBD. CBD is great to be able to help your body with inflammation. There's a number of different medical benefits that you get from it. And so by reducing the amount of THC, increasing the amount of CBD can help quite a bit. And Michael, this will help you quite a bit, for example, with things like insomnia, in agitation and things like that. You've seen this happen, haven't you?
I have, Mark. In the dispensary from personal experience, sometimes your symptoms and some of the patients, what they're medicating for, ideally we would want to ultimately stop to get, to take that, official tea break. But it really depends on the individual. This is exactly what I recommend: tapering off your dosing, lowering your amount of THC, increasing your CBD intake, whether it be gummies or capsules. And this will still lower your tolerance, shall you say. And then when you resume, you'll still be in a healthy, I guess, threshold area where you're still sensing the benefits. But
Right.
rather than just stopping and, triggering those responses, and it's for some patients it is easier to taper down your dose.
Let's look at the next question. Is cannabis use disorder an addiction? That's an excellent question because I tend to look at an addiction as something that people really, in many ways, have difficulty controlling. I use cannabis to get rid of pain. Am I addicted to cannabis per se? The answer is no. Am I addicted to getting rid of my pain? The answer is yes. So I think this is something that's it's really, really important. And I think that the answer is cannabis use disorder if you are using it for non-medical marijuana uses or not to address a particular medical marijuana use? The answer to your question is yes, it is. And it's something that should be treated that way. And again, we talked a little bit about substance use disorder, and we also talked about behavioral addiction. Those are two different issues. You have to keep those in mind that are really there. I would say that if you're worried about whether you have an addiction, get a hold of a medical professional, or if you have difficulty or you're concerned about doing that, get a hold of a friend, get a hold of somebody who you can confide in and talk to them about it. They'll actually, if they're really somebody who really knows you and can work with you, can help you decide whether it's really something that's, is cannabis overpowering you to do certain things, like driving, for example, when you shouldn't be doing that? Or is it something that you really need to have in order to be able to address that particular condition? So the answer is yes. And I would, again, if you have any concern at all about if it's an addiction, get a hold of a professional, work with them so that they can actually help you with this particular condition. Don't leave it untreated. It's not something that is going to go away by itself. Let's put it that way. And it's something that with professional assistance can really help you get back to the state that you really want to be. Let's jump into the next question. If you have cannabis use disorder, do you have to stop taking cannabis completely and never take the product again, even medically? Now, that again is a very, very good question. The answer is yes and no. Okay. So if you suspect that you have cannabis use disorder, the best diagnosis and the way to get rid of it is to actually stop using cannabis. Now, in many cases, I would suggest working with a healthcare professional or a medical professional to do this, or somebody that can help you with supportive treatments. The problem that you have is that it's very difficult to do that, especially if you're a recreational user. This is something where you haven't been going through the process of dosing. You don't understand the whole biphasic method of cannabis. You don't know what your therapeutic dosing level is. You've jumped right into that right-hand side of that spectrum that really causes the issues that you really don't like to have about cannabis. But the answer is you should stop using it to find out if, in fact, this is something that can help you. However, if you're getting some negative side effects, if it's something that, if, for example, you have some pain issues, things like that, reducing the amount that you're using will really help. It's not to get rid of it completely is a black and white issue. To be able to manage it, taper down slowly to a point where you can actually manage it. And if you have a medical use, but you still feel that you're using too much of it, then this is something where you may want to actually still continue to use cannabis to address that medical use. But again, as you reduce that amount of cannabis that you're using, you're going back to that left-hand side of that chart, where you actually start again going up to the relief syndrome that's there. Michael, what thoughts do you have on this?
I just, I agree with you. Now, I've had friends and people that, so this webinar tonight was new to me. These are answering a lot of questions that I've had and that I've thought of, and people have asked me. And I wasn't quite sure, but, assuming the feelings and the effects people were having, in my opinion, it's kind of both. Some patients, are okay with taking a tolerance break or tapering down their dose, and this resolves a lot of the negative symptoms they're having. But I have seen individuals who need to consult with a physician, friends. They're getting extremely negative effects, and that's something you need to be aware of. If it's hindering your life or affecting any major decisions, this is something you want to seek help with.
Sure. And
Just
Michael,
because.
you've run dispensaries, you've actually dealt with a number of patients, and so it's something that, again, and what I find interesting is with all that experience that you didn't have as much knowledge or data and background on these particular conditions, which I think will help a lot of folks that are out there. Again, you can taper down. It's important that you stop to really overcome this. And again, in 24 to 48 hours, you'll begin to feel the symptoms. After 30 days, you'll be able to really see what's really there. But again, tapering down, backing off is difficult to do. Seek help from a friend, medical professional, or something like that. Let's look at the next question, which is there a cure for cannabis hyperemesis syndrome, or is it forever? That is, again, another very good question. There is no known cure for this particular condition. CHS is something that they're still studying, that we kind of understand why, but we don't understand exactly we know exactly how to get rid of it, which is to stop using it. But I think the issue becomes, if you stop using it and you get over that, can you continue? Can you go back to using cannabis. And that's something that there hasn't been a lot of studies, there hasn't been a lot of information on it. So it's an area that I don't want to give a black and white answer to. I do know most medical professionals will say, stop using it altogether. I do say that if you're a medical cannabis user and you go through the proper dosing, if you take a holiday break more than 30 days, maybe even 60 days, and then you know you're getting over it, you working with a medical cannabis professional to do the proper dosing, you'll be able to figure out rather quickly whether you can, or have you overcome that situation, whether it'll come back or not. And again, this is a condition that brings on a lot of violent vomiting. So if you start going back to it and you start getting that condition, stop immediately. That's the best advice that we can give you. It's something that, unfortunately, there's a good chance that the majority of folks will actually stop using cannabis altogether, using this altogether. There are some treatments that people have used, which are a lot of the professionals, medical professionals will recommend hot baths. They'll recommend using some capsaicin cream and that type of thing. But those are only treating the symptoms. They're not treating the problem. I'm talking about treating the problem with CHS. And that particular situation is stop using it at least for 30 days and then work with a medical cannabis professional if you want to take a look at going back to it. I think if you're a medical cannabis patient, you'll want to do that. But most people who have CHS are not medical cannabis patients. They're really recreational users. It's something that's out there. Next question I want to ask is, what do you do after the doctor says you have a cannabis use disorder? Michael, do you want to take this one? Because I think one of the things that comes up is really asking the question of, is it affecting your daily activities? Is it stopping you from doing the things that you really want or should be doing that's there? Your thoughts on that?
No, Mark, I'll just add in, if you're diagnosed with that and the doctor is telling you that, that's something you're gonna look at or reach out to people around you. Are you not getting activities done? Are you feeling, sick or lethargic? And, is it affecting your daily life? And like we said before, taking that break, this may not be something that you have to stop forever, but it could be signaling, if it's affecting your daily activities, this is signaling that it's time to take your tolerance break or taper down that dosing, especially if the physician or your provider has told you this. So
Right. And I think the issue is really, if the doctor has now said that you have cannabis use disorder, really look at it a couple of things, especially if you're a recreational user. Number one, use that tolerance break. In fact, try to take as much as 30 days off to see if you can actually help your body reset and really get rid of this particular condition. Sit down with your medical cannabis provider, sit down with your medical marijuana doctor or your medical marijuana practitioner, work out a plan for therapy and journaling that can really help you understand, have you found that therapeutic tolerance level, or are you really heading over to the part of the biphasic range of cannabis that's really hurting you? And really, once you understand your therapeutic dosing level, it really makes a big difference in using medical cannabis professionally. Again, work with a medical professional, cut down, and really take a look at listening to your body. The most important thing to do is listen to your body. It'll tell you if you're getting over it, it'll tell you what's happening, and it'll give you a lot of feedback as to what you should be doing. Again, working with professionals to really help you get over this particular condition. Next question is, what's recommended to help with sleep and general aches and pains? I recently had a coronary stent put in, so I won't smoke anything. The key here is, in many cases, you really don't have to smoke cannabis. I think there's a perception that cannabis is really smoking, and really there's a lot of different ways of taking cannabis. There's a lot of what we call routes of administration, and also knowing the terpenes that are in play to address your medical condition is really important. Now, if you're a recreational user, you don't care about the terpenes because you're just using it to really for a recreational purpose. But if you're a medical cannabis user, you can actually look at other different routes of administration. Michael, tell me a little bit about that, because there are tinctures, there are sprays, there's the famous edibles, which capsules fall in that category, topicals, there's inhalation. There's different ways that you can take medical cannabis without smoking that'll really help you be able to, again, in this particular case, they're asking, can you help with sleep and general aches and pains? I tend to use tinctures and I tend to use capsules more than I use inhalation.
No, Mark, other than I agree with you, everybody has the stereotype or stigma that marijuana, they automatically assume smoking. And there is many different routes that you can take and use the product to get the benefits you want. As Mark mentioned, he loves the tinctures and our RSO capsules. They come in 10 milligrams, 30 milligrams. They work great. We have, if you're somebody who doesn't want a high dose of THC, we have edibles, gummies that are THC and CBD. This is
We
good
should
for.
point out something really important, Michael, for a lot of folks. And again, I don't know the knowledge that people have about different routes of administration, but tinctures take about 15 to 20 minutes to work, and they'll work between 4 to 6 hours. That goes the same for sprays. But when you get into capsules and edibles, they can take up to 2 hours to work, although they work between 6 to 10 hours. So if you want to get a good night's sleep, you may want to try that gummy. You may want to try that brownie or something like that that can really help you. But it may take, again, up to 2 hours of work, at least probably about 30 minutes, could be an hour. Don't, if an hour goes by and it's not working, wait. Be cool, okay? Just back off a little bit. What you don't want to do is eat these things like Skittles and then find out 3 hours later that you've taken really too much and you've gone into that right-hand side of the biphasic phase that's really there. Those are kind of important pieces to know. There are different ways of taking it besides inhalation, but you want to be able to know the onset time and the duration time that can help you quite a bit. Topicals, for example, are a good example of that, right, Michael? Because topicals work almost immediately and they work between 1 to 2 hours, right?
Exactly, Mark. I was actually just about to say I didn't get to topicals yet, but those are great. They work almost instantly. I've used them. I've had patients use them for chronic arthritis, chronic pain, or we have patients that have used it for acute pain. For instance, me, I've used it for pulling a muscle in my neck, and it helped coach me through like a whole, 4 to 6, 8 hour shift at work. I
Mhm.
couldn't even turn my neck to drive, and it really helped. We have ones that are just a cooling THC, or there's balms that have CBD, which, in my opinion, the CBD and THC combination is great. CBD helps with inflammation, swelling, the same thing, and then the THC targets your pain.
Right.
But these are great. Some dispensaries have patches, which are really work really well as also. So it's just about what you like, what you're comfortable with trying. But I always encourage, don't just worry about the smoking aspect. So many patients and medicate and they don't even smoke. They've never even smoked, and they get great benefits out of the other options out there.
And Amy, our nurse, recommends really taking a look at using things like tinctures. Tinctures are very, very effective to help you. Also, edibles are very helpful to help you be able to alleviate, to fall asleep and to stay asleep. I typically, about an hour before I sleep, I'll take an edible. Well, I'm a chocoholic, so I'll take chocolates or I do make my own brownies. I'll use that, but I'll take an hour before I go to sleep, and that'll help me stay asleep the whole night, which is really, really important. You should be able to. You should look at that as something that's there. Also, take a look at a product that's indica leaning. These are ones that will help you be able to get to sleep. Or if you use a sativa leaning product, then it's something that could stimulate you and you really don't want to really fall into that particular category. One last thing I do want to point out about routes of administration, Michael, you and I have talked about this before, is the concept of smoking, quote unquote, smoking, which really can be broken down into three categories: rolling a joint, smoking it that way, using a vaporizer, or using dabbing, which is you see on the chart here, it says inflammation, flower, and concentrate. If you roll a joint and you roll that up and then you go to light it, that 550-degree flame that you're using to light that joint will burn off about half of the cannabinoids, most of the terpenes, and most of the flavonoids. It's going to reduce the medical efficacy of that particular blunt approximately 40 to 60%. Now, that's the bad news. The good news is it still works, but you typically have to use more of that particular product or that method in order to get the same relief that you wanted before. Where if you use a vaporizer, a dryer vaporizer, where you actually take that cannabis, put it into a container, drop it into a device that heats it, steams it, and basically then once it's steamed, you're able to smoke it just like you do. But the nice part about dryer vaporizers is you can set the temperature of that dryer vaporizer. In my particular case, I use 356 degrees on my dryer vaporizer, and allows me to trigger the myrcene and the beta caryophyllene that I need to really address the inflammation and the pain that we're really looking for. And that's really, really important, Michael. I think a lot of people don't understand dryer vaporizers are probably the best way to quote unquote smoke, although there is a whole therapeutic value in people rolling joints, right?
Yes, Mark, you're correct. So as Mark just said, to get the best out of your product and more bang for your buck, I do encourage patients to use either dryer vaporizer for your flower. Air dispensaries sell these. We don't have that specific brand, but we do have a little more affordable to get you started, get you opened up. And then, of course, we have all of our vape batteries and concentrates devices have different heat settings for you.
Right.
That way you can target the terpenes you're wanting to activate. But as you said, smoking the joint, it has the whole, for some patients, that's how they medicate. You are getting the highest
Yeah.
THC percentage. Just keep in mind, you may want to try some of the other options out there. If you're somebody who's smoking a lot of flower, you're not reaching the benefits you want,
Yeah.
or potentially having symptoms of cannabis use disorder.
Yeah, I mean, one of my good friends, Jeff Dumont, who runs the Grateful Veterans, which does a great job supporting veterans use with PTS. He loves rolling his joint. That's the grinding, the making the joint. That's part of the therapy that he uses with medical cannabis. He also now realizes, since I've worked with him now for about a year on this particular issue, he does realize to get the most out of his product and basically to cut down the costs of running through a lot of cannabis. A dryer vaporizer is the best way to go. But again, it's all individual. The one thing I love about cannabis is you're in control and it's individualized for your particular use. And that's really, really what's important. Michael, let's jump on to the next question. It says, am I kidding myself that I use cannabis for pain control? I have a MASD autoimmune disorder. I guess the question becomes, pain is something that is different for every person. I have a high tolerance for pain. I know of some people that don't have a high tolerance for pain. And so it really becomes, what is your tolerance? And I'm not going to debate that. I'm not going to get into that. But I do know that you can use cannabis for pain control. I've seen it used effectively for a lot of different conditions. Now, that being said, every person's body is different. Just like alcohol, just like caffeine, everybody has a different tolerance. I have friends of mine who can take one drink and they're done for the night. I have other friends of mine that can drink the whole bottle and they're just getting started. Same thing that happens with cannabis. I think what happens is that in many cases, people just grab a product, start using it, maybe use it more than they should because they've dropped into that, they get past their therapeutic dosing level. They don't even pay attention to what that is. They don't know how to find it. Let's put it that way. I'm not saying they're trying to do anything negative. They haven't been coached and properly treated on that. And so the question becomes, what is that therapeutic dosing level? If you can find that, that'll help you quite a bit. I think the other thing that you got to look at here is terpenes are critical to getting the medical benefit that's there. In many cases, people will come to me and say, Mark, I'm using medical cannabis for this particular condition. It's not working. I look at the product they're using, I look at the route of administration they're using, and the product that they're using doesn't have the terpene profile that addresses and can help relieve that particular condition. And by simply adjusting the product that they're using, in other words, which product they're using to have the terpene profile, magically, all of a sudden, it starts helping with their pain relief. And that's something that you may want to take a look at. You're not kidding yourself. Cannabis can help with pain control. But again, the trick is, and the key is, right terpene profile, make sure that you're setting the right temperatures that's there, and or using the right route of administration to really help you with this particular situation.
Utilizing the tools, the setting your, getting the right or getting the right temperature setting. Try not, maybe try alternative methods like the dryer vaporizing. Definitely, THC products are going to help, CBD. But I always encourage, ask your bud tenders, ask
Mhm.
your dispensary staff. Of course, always your providers are there. Us that work at the dispensary, we work with a lot of these products. We work with a lot of patients. And then, of course, use these tools, the temperature settings to
Mhm.
activate your terpenes. Go online and look at the certificate of analysis. That way you can really dive deep into what you're trying and really, figure out your therapeutic dose that works for you. And of course, your preference of how you want to take your product.
And please understand, for folks that are watching this, our whole focus is from a medical marijuana standpoint. Our goal is to really help people get their life back and really use cannabis to really address their particular condition. If you are a recreational or adult use, you're not concerned about that. You're concerned about using this to be able to basically get the enjoyment of the high that comes from this. And that's something that's completely different. There's two different focuses on how to use the product. When we talk about a lot of the symptoms and how to work with it. We talk about terpenes and things like that. We're really trying to target that profile that helps you get your life back. Again, if you aren't in that particular area, we understand it, and that's okay. I mean, I'm very pro adult use, recreational use of cannabis, but I do want people to understand if you're going to smoke it constantly and you're going to do it for years, you're moving over to that right side of that scale that we showed you, and it's going to really begin to affect your body to the point where CHS can come into play, and you can develop that vomiting that's there. Michael, let's jump into the next question. That is, does CBD or THC work better for sleep? Really, really good question from the standpoint of what's the most effective thing. And basically, THC is the most sedating of the cannabinoids that are there, but CBD also helps be able to counteract a lot of the THC high, but give you the benefits of using THC. And again, going back to what can help you fall asleep and stay asleep, here are the list of terpenes: the linalool, the myrcenes, the terpenolines, the germinal, and boronol. These are the products that can help you, having this terpene profile, help you sleep. And again, I also recommend a route of administration, which is an edible, which could be your gummies, your brownies, your cookies, whatever that's there to really get you that 6 to 10 hours of coverage. Michael, your thoughts on this? Because I think, again, THC is the best approach, but I wouldn't shy away from CBD. I'd use CBD to really help be able to enhance the ability of THC to do its job. Your thoughts on that?
No, Mark, I'm aligned with you. THC is going to give you most of that sedating effect, relaxation. Now, of course, keep in mind you want to look, if you're looking for sleep, if you're using THC, you want to try to aim more towards your indicas.
Mhm.
But of course, double check with your terpene profiles online on the certificate of analysis, just to make sure you're aligning with these terpenes, which uh, most indicas have these in them.
Right.
CBD
And
is
also point out,
perfect
Michael,
as
excuse me, I'm going to point out you're hitting on something important. They should take a look at using a ratioed product. That a ratioed product is one that
uh,
combines THC and CBD, right?
Of course, and they will come in the form of tinctures, which is perfect for patients who are starting out. Tinctures are good for really being able to control your dose if you
Yes.
just want to maybe take like 2 lines, or if you're a patient that, you have high insomnia and anxiety, and you'll lay there all night, you might need half to a full dose.
But
There's
also, if that's the
capsules.
case, the route of administration is important because this is where you want to play. You want to use your gummy. You want to use your edible. Get that 6 to 10 hours of coverage versus a tincture, which, by the way, when you use that, will work for 4 to 6 hours. So if you use it at 10 or 11 o'clock at night, you're going to wake up at 2 or 3 in the morning. You're going to need to use it again, and it'll be a while before you fall asleep. Where if you use an edible, like let's say a gummy or a brownie, it'll take you through the whole night. That's really important to understand the route of administration too, right?
Yes, Mark. And then, another option we didn't, what you love, the capsules. The
Yeah.
RSO, whether it be a form of edible in the syringe, or the capsules, those both work as great products for sleep as well. Another form of edible that we have, most of our gummies, if not, or well, actually, all of our gummies offer an option with CBN, which
Fine.
is really good for sleep.
Yeah, that's a good point. CBN is excellent to help you. That particular cannabinoid is really helpful for sleep. Let's jump into the next question, which is when I take edibles and RSO, I don't feel anything regardless of the dose. What can I consume alongside edibles to experience the benefit? Every person's body is different. And that's, I think, is something to really point out to folks. One person, you get the question of what should I take? What is the prescription? And it's not take 2 pills and see me in the morning. Unfortunately, cannabis doesn't work that way. Candidly, neither does pharma drugs, but that's a whole different subject to get into. This is a situation where your body is going to tell you what works and what doesn't work. Some people find that they can only get the relief they want from inhalation products. Some people find out that it's really not there. What you're talking about, I don't want to get overly technical, but I want to point out that there's a P450 enzyme that metabolizes both THC, CBD, and other cannabinoids, and depends on how your body processes that. In other words, there's a specific gene variation, which is the CYP2C9. I'm not going to try to get technical on you, but this is where your body metabolizes the cannabis that's there. This is the difference between why some people have low tolerance, some people have high tolerance, and we know exactly why that is. You may want to be able to experiment with a couple of things that really help you with that. Now, RSO, I should point out, is very strong. This is what I consider to be what I call the 151 Bacardi of the cannabis world. So if you are taking edibles, you are taking RSO, what you may want to do if you're not feeling anything is really talk to your medical cannabis professional for two reasons. They'll help you figure out the right amount of product to take, and they'll also help you identify the right terpene profile with that really helps you. Now, in the case of RSO, because it's a whole plant product, all the terpenes are there, but in the edibles, maybe not. That's something that really works along there. And again, people again with high tolerance, you may be a person that has very high tolerance. I have friends that have extremely high tolerance, and I'm amazed at how much cannabis they can consume before they feel the benefits that are there. Like alcohol and like caffeine, it just depends on your individual body. Don't look at this as a negative. Look at it as something where work with a cannabis professional who can actually help you identify the dosing process to identify your therapeutic dosing level. That's what you're really looking for. And in many cases, it also may be making sure you have the right terpene profile, because just taking product by itself may not necessarily help it, especially if you're in the edibles category. Let's jump into the next question, which says, I've been suffering from chronic depression, anxiety, and migraines for 30 years. Will cannabis still help me? Michael, this is a very interesting question. What's your thoughts?
Well, so being a patient that suffers from similar, symptoms, or dealing or helping a lot of patients that have those symptoms as well, it definitely will help.
Yeah, you're a
I
person that has
do.
the anxiety that's there, and you found that cannabis helps you quite a bit with it. In fact, it's one of the ways you manage the anxiety in your life, right?
Correct, Mark. It is very helpful. I'm a firm believer of edibles. I'm also, I like to smoke. I've recently been exploring other options with thanks to Mark's coaching with my terp settings and my heat settings. But I am nostalgic, something therapeutic about either packing a little pipe or rolling up here and there, really is calming. But also, I love edibles. I use RSO, I use
Mhm.
regular distillate syringes. But keep in mind, yes, it will help for these symptoms and can help manage, with in addition to other things, manage these. But cannabis use disorder can have an effect and make these symptoms worse and bring
Right.
out symptoms like this that, according to my observation and helping with other patients. So.
Yeah, I think it's important to point out if you're a new, if I don't know if this question came from someone who's a new user of cannabis or somebody just getting into it or somebody who's used it for a while. I think going back and going through the dosing process and understanding your therapeutic, your therapeutic dosing level versus other folks. Everyone is different. Will really help you quite a bit. I've worked with patients that have had chronic conditions for a long time, tried a lot of different things, not necessarily cannabis, and really have been frustrated. And once we go through the process of getting getting the proper dosing level, identifying the terpenes, and getting them a route of administration they're comfortable with, it's been almost miraculous to see their change in being helping them get their life back. Let's jump on to the next question, which is what's the best cannabis combo for osteoarthritis? I have to tell you, I've worked with a number of folks with arthritis, and cannabis does work with them. I think the key is really using a product that has the right terpene profiles, which is the pinene, linalool, myrcene, and beta-caryophyllene, and also very important in people who are addressing arthritis, whether it's RA or OA. What you want to do is you want to actually have a high level or a CBD that's part of that particular combination. You may use, we call ratios. You'll hear about 4-to-1 or 1-to-4. The first number is the amount of CBD. The second number is the amount of THC that's in the product. I would recommend a product that's 2, 4, or higher to 1 ratio, more CBD to THC, and start with something that's 2-to-1, maybe go to something that's 4-to-1. People have found that the more CBD with your THC has really helped with arthritis. I had a patient whose hands were literally closed and had been closed for a while. She couldn't hold a remote control. She couldn't hold a knife, fork, and spoon. She became a recluse because she really was afraid to go out in public. She was embarrassed to not be able to eat at a restaurant. And by being able to get her the right products, after 2 or 3 weeks, her hands began to open up. After a month, she was able to get about 60 to 70% of her movement back. She was able to go back to eating. She was able to go back to certain things. And today she's actually knitting, which is really interesting. I think it's really important to pay attention to a product that has the right terpene profile and the right ratio. And again, that ratio is one that's higher with CBD. Your thoughts on that, Michael?
No, I'm aligned, Mark. It's lots of
Don't forget to
dispensaries.
Michael mentioned topicals, because topicals are really key here.
And topicals are going to have that combination of, we have some that just have CBD, or we have the ones that have the combination of CBD and THC. Topicals are great to not give you those psychoactive effects from the THC. They're absorbed through the skin, they work right away. I've had patients who they can't carry on their day without that stuff. Like,
Yeah.
it's phenomenal how well it works.
Yeah, yeah, and I think the answer is it's very effective for arthritis. And again, I recommend a product that has a higher CBD to THC ratio, and then also so a ratioed product. And I recommend topicals work great, tinctures work great, and naturally, if you're taking a look at edibles, that's something that can work very well. But find an edible that does have the ratio to it. There are edibles that have THC and CBD that are in there. Michael, let's jump to the next question, which is, can I use cannabis products for insomnia? This is an issue that you've addressed and dealt with it quite a bit in the past. The answer is, he says, I've tried it and it didn't work. I'm going to go back to, I understand you tried it and it didn't work. Get a hold of a medical cannabis professional, because we have webinars on this to talk about insomnia. We've done sleep webinars with Dr. Greg Holt, who's the head of the Sleep Association here in the United States. We've talked about medical cannabis. And by the way, we have a video on our YouTube channel, just talks about sleep in general, not necessarily with cannabis. They can really help you quite a bit. The answer is, make sure you have the right terpene profile, and then also make sure you're using a product like an edible, a gummy, chocolates, things like that, that'll last the whole night, that's really out there. Because if you have used if you're using the right route of administration and you're using the right terpene profile, this will help with sleep quite a bit. In fact, it's one of the best treatments for insomnia. Your thoughts, Michael?
I just want to add in what we said earlier. Keep in mind, look at your certificate of analysis. Most sativas can have an effect if you're a patient that has insomnia. From personal experience, they can keep you up and increase those insomnia effects. So most of your indicas, several of your hybrids, if you don't want to, straight indica, but most importantly, look at your COAs, look at your terpenes, look at the benefits you're wanting, and of course, factor in your dosing. You don't want to overdo it. You don't want to bring on the insomnia because you're going past your therapeutic
The
dose.
therapeutic dosing level. I think that's really key. If you go past the therapeutic dosing level, you will have trouble sleeping. And that's why when it says I've tried it and it didn't work, my question is, and again, I'm just not trying to be negative or combative. Do you know what your therapeutic dosing level is? Because if you don't, that's going to be the magic that really help you with your insomnia and to pick the products that you really want to use. I can't stress that more. Again, I have a perspective of medical cannabis, not recreational cannabis, and it's something that you may want to take a look at. Let's look at the next question, which is, I was diagnosed with bipolar disorder 13 years ago. I've been able to cut back on anxiety medication and cut out sleep medication. This is something that is really important. A lot of people that have used bipolar have basically been able to taper down on the products that they're using. And it really will help people. Again, we mentioned earlier about the anxiety part of it, which I think is really, really important. Cannabis will help with that anxiety that's really there. It's something that, again, check out the COAs, check out what's there, work with a medical cannabis professional. They can really help you be able to get off a lot of the medications from bipolar. You may not get completely off of them because, again, every person's body is different. But working with a professional, working with somebody who knows cannabis, who knows medical cannabis, can really help you in this particular situation. And again, the terpenes you want to look for are the limonene, linalool, myrcene, and caryophyllene or beta caryophyllene. All these can really help you quite a bit. Michael, you've seen a little bit of this, haven't you?
So I actually, patients that struggle with bipolar disorder, I actually had helped a lot of patients, and this is very common, actually. And, guys, this is something there's really no way to just be strain specific and tell a
Mhm.
patient that, they want to try this or they need to try this. It's really targeting those terpenes, looking at those COAs, because each one of us are different. Our bodies react differently. And, I've seen patients who, they do sativas to help with their, bipolar and, their symptoms. But then I have somebody else who does indicas and hybrids. And, so there's just all of us are a little different. The way we
And
metabolize THC is different. And the
yeah,
best thing is to
and it's important,
target to
Michael.
get.
It's more important, Michael, to show them. We know these terpenes work, but where the random factor comes into play is what route of administration are you comfortable with? In other words, how long does it take effect? Does it take, if you're eating an edible, does it take 30 minutes? Does it take 2 hours? I think the other thing to pay attention to is to make sure that when you go to a dispensary, there's many, many different products that are there. And in many cases, you may find a product in one dispensary that the name of that a cultivar, by the way, is a combination of cannabinoids, terpenes, and flavonoids targeted for a particular condition like sleep. They may not have the same names, but they will have the similar terpene profile and they will have a similar cannabinoid profile that are in there. That's something to really pay attention to, that really help people right away. And that goes back to what you were saying, Michael. Look at the COAs. The COAs are really the key to being able to get a product that will really help you. Because once you know the products that work for you, the terpenes that work for you, then you're able to get into the COAs and the route of administration. That's the magic to being able to use medical cannabis. Michael, let's
And
jump.
I will.
I'm sorry, go
Oh,
ahead.
sorry.
Go
No, I
ahead.
just want to add in, and if you're somebody who's not comfortable with getting online and pulling up the COAs, ask your bud tenders. All of us at AIR, we can pull that information up with the register.
Mhm.
We have experience with our products. We hear patient feedback, and we're happy to help you, guide you through that and help you find products that actually target what you're wanting and that can, give you the best benefit rather than just trying something that, may have worked at another dispensary, but, it's not the same product or,
Right.
it has a similar name. There's just so many cultivars out there. The best thing, is as we've said, look at your terp profile. But of course, like I said, if you're, feel free to ask your staff, ask your bud tenders. That's what we're here for.
Good answer, Michael. That's good. That's good comments. Thank you very much. Next question is, what can I use for nerve pain from fibromyalgia? I don't get high from smoking. Well, there's a number of different terpenes that are good for fibromyalgia. And by the way, cannabis works very well for fibromyalgia because it has a neuroprotectant capability that really helps be able to, it's not going to reverse it. It's not going to get rid of it, but it will help you manage it. It will help you manage the pain because that sharp burning pain that comes from fibromyalgia is something that you really want to get rid of. What you want to get rid of is, in many cases, relief of the nerve pain. And by the way, smoking is or vaping cannabis is the best way to go. And this is where your dryer vaporizers come into play. They can help you quite a bit. But again, the objective of using medical cannabis is not to get high. The objective of medical cannabis is to relieve the pain that's there. If you want to smoke it to get high, that's a different issue. You probably just need to smoke more of it to get there, candidly, because you may have a high tolerance. To be able to address your nerve pain, this is where you pay attention to, again, the terpenes and the route of administration, and it will work for you. Every person's endocannabinoid system is different, and that's why it really is important to go through the trial and error to do the dosing profile, because once you find that therapeutic dosing level, it really helps. I don't have fibromyalgia, but I have neck pain. Once I found that my neck pain was going away, once I found I was getting it under control, it was like a whole new day. I was going from a pain level of 7 or an 8 down to a 1. And right now I keep my pain level as a 1 or below. Again, if I use too much of it, my pain starts to come back and I know that I need to taper back and use less cannabis. It may sound crazy. Use less cannabis to get more benefit from it.
I'm just gonna add in, not only vaping or dryer vaporizer, another form, maybe you just need to try different forms of administration, such
Well,
as
your RSO capsules,
topicals,
for example, would be great.
capsules, edibles, maybe increase your, as we've mentioned before, increase your CBD intake. That way you're targeting, the inflammation. But there's multiple ways, and as we've said earlier, that's the benefit of medical marijuana, and you can really cater your therapeutic or your results. You can cater the result you're wanting to you and your needs.
And key is, many people say, ask you can't, when you ask your doctor what to take, a good medical cannabis professional will say, I can't answer that question. Listen to your body. Your body will tell you if it's working or it's not working. The best measure, the best meter that's out there is your body. Your body will tell you what's working, what's not working. And that's why you need to look at it. And that's why journaling is such an important part. You journal and you find out what's working and what's not working in different situations. Michael, let's run on to the next question. It says, how can I reduce migraine headaches by using medical marijuana? Medical marijuana is very effective in addressing migraines. Again, here's a terpene profile. There's a different terpene profiles that could really help with that. And I know that, in fact, there's been a recent study that came out of Israel. It was actually published approximately 5 months ago on migraines and medical cannabis. And what they actually established and they showed, which was the 5th study in a series, that in many cases, migraines is a lack of endocannabinoids, that your body is not producing enough endocannabinoids to address that particular situation. So by adding the phytocannabinoids into your body, which comes from cannabis, it can help your body be able to have the cannabinoids it needs to be able to address that particular situation. So the answer is yes, it works, but also you may want to take a look, you might want to take a look at products that work basically right away, because when migraines are coming on, you're going to want to have immediate relief. And that's where the vapes come into play and the sprays come into play. Your thoughts, Michael?
I'm just aligned with you. Some products take longer to kick in. Personal and patient use. I or for per patient recommendation and what I've seen. Be careful with smoking flower. Sometimes that may make you cough a little bit more. If other than that, I like tinctures, the nasal sprays, or they have inhalers. Those work really well. And of course, your vapes,
Yeah. Well, and I think
your
the point is start early. When you start feeling the symptoms of migraine, address it then. Don't let the migraine come on and then try to address it. It's a little harder to be able to,
correct.
when you get that full migraine, it's harder to back it down than it is when you're first starting out. It's easier to kill the alligator when he's small than when he's big. Let's put it that way. That's something you may want to take a look at. Michael, let's jump on to some live attendee questions that really came up. Let's jump into those. I guess we had one, which is there a loss of appetite, no vomiting? Is that the same thing? The answer is yes. In many cases, the key, and they really key off of vomiting when they took it, especially CHS. That's something that's really there. But if people start experiencing a lack of appetite, it's beginning to affect your digestive system. And by adjusting your digestive system, it's same things just not going right. And by not going right, you might be using too much cannabis that's out there. You may not be using enough to induce the vomiting, but you're using it enough to cause your digestive system to really try to address it, and it's addressing it by in many ways is a lack of appetite. Cannabis, in many cases, causes people to get hungrier. They get the munchies that come from that. So if you're getting into the loss of appetite by using cannabis, there might be something that you really want to take a look at. I think that's something that's really out there. I think that's something that's there. I want to say I'll answer this question as yes, but again, contact and work with your medical cannabis professional. Because what they'll do is they'll help you be able to really diagnose and figure out exactly what's going on with you. So I think we've answered almost all the questions that are out there. I want to thank everybody for attending tonight. It's been a long webinar. We answered a lot of questions. We covered a lot of topics. Michael, do you have any final thoughts?
No, this was just very informative. I didn't, personally, this answered a lot of questions for me and several questions patients have asked me.
Mhm.
And it was very insightful. I really enjoyed this, and I hope it was educational for all the patients as much as it was for me.
Great. Well, Michael, I thank you for helping and the contribution that you make, and for AIR for helping to sponsor this. Thank you very much for doing that. I do want to mention that I want to thank everybody for watching. It's been a long webinar. I know we covered a lot of topics and a lot of subjects. Hopefully, it's been help you be able to get your life back. That's the objective of what we're trying to do here, is really help people get to a point where you may not get 100% of your life back. In my particular case, I probably got 95% of my range of motion and things back. But I got my life back. I'm able to do the things I need to do. I'm able to enjoy my grandkids. I'm able to enjoy my martial arts and things like that, which is really, really important. I want to thank everybody for joining us tonight. I think it's important that you understand we're here for you, like the medical marijuana treatment centers and like AIR that's there that really help you get your life back. And more importantly, our goal is to really help you get your life back. Please check out our YouTube channel, youtube.com/marijuana aware, to really help you. And also, we'll have a whole new series of shorts, which we call snippets, as well as medical marijuana seminars coming next quarter. Thank you very much for joining us.